For the past 30 days, Lexus of Watertown and Susan G. Komen of Southern New England have been working together during their second annual Pink Tie Guy campaign to raise awareness, support, and funds for families fighting breast cancer in Southern New England. Throughout October, recognized nationally as Breast Cancer Awareness Month, men across Massachusetts were invited to step up and join in the local fight against breast cancer. Pink Tie Guys are a community of men committed to making an impact in the local fight against breast cancer, given that 1 in 8 women in the United States will be diagnosed with breast cancer in her lifetime. Now, according to the National Cancer Institute, Massachusetts has the second highest incidence of breast cancer in the United States. This year, more than 5,000 residents will be diagnosed with breast cancer. To tell us more about how they did this year and their upcoming reception this week, we've invited Lori Van Dam, who's the Executive Director of Susan G. Komen, Southern New Hampshire. Welcome to Urban Update. Thanks for coming in, Lori.
Thanks for having me.
Now, I guess everyone knows why I'm wearing the pink tie now. Why don't you tell us what you've been asking men to do all month?
Right. Well, thank you for being a Pink Tie Guy along with the rest of our group. The goal of the Pink Tie Guys is to do two things. One is to recognize the role that men play in supporting the women in their lives with breast cancer. Of course, men can be diagnosed with breast cancer. That's about 1% of diagnoses. But far more men are affected by the women in their lives. And we wanted to give them an opportunity to take some action to support those women. So the Pink Tie Guys raise funds. We asked them to raise $1,008, which represents that 1 in 8 that you were talking about, American women who will be diagnosed in their lifetime. And those funds will go to support local programming for breast cancer, both research and also support.
So take me to the process of, how these men, go about raising the money and what's your goal. Your goal is $108,000. And do you expect to make the goal?
Well, that's a pretty big goal for us, so we're not quite sure we're going to make it, but we're going to try really hard. Typically, this is the kind of thing where men get involved with us because there is someone important in their lives who is fighting or has fought breast cancer, and so it's pretty easy for them to go to their communities and ask them to support them.
I was going to ask, how do you describe these guys, these Pink Tie Guys? Who are they?
They're fathers of survivors, they're husbands of survivors, they're the children of survivors or women who have lost their fight with breast cancer. So it's really a broad variety of men who are impacted by this disease.
Now, what role does Lexus of Watertown play? I understand they're your partner in all of this?
Yes, they're a wonderful partner for us. We've worked with them last year and we're working with them again this year. They have some of their staff who are raising money, and they're helping us spread the word about the importance of getting your screening and being aware of your own health, being your own health advocate.
Tell me about, if you give our viewers a reminder of the Susan G. Komen Breast Cancer Foundation and how that works.
So we're the local affiliate for a national organization, and when we raise funds, 25% of those funds go to our national research pool to support that very important research that's going to find the cures and the causes for breast cancer, and 75% stays here locally to support families. And one of the big initiatives that we have is a patient navigation initiative to help make sure that women get into screening and then get into treatment if they need it, because our experts tell us that up to 1/3 of the women who are currently dying from breast cancer could actually be saved with current treatments. No new research breakthroughs. It's just getting women into the screening in time and then getting them the timely treatment that they need.
Earlier this month, you released your community profile of breast cancer in Massachusetts. Tell us a little more about that.
So that's an evaluation that we do every 4 years for all of the areas that we work in across the nation to understand what the services are that are available and also what the need is. And we identify particular locations that have both high incidence of breast cancer, high late-stage diagnosis, which can indicate a problem getting women into screening, and also high mortality, and then we target our efforts to those communities.
And what about the disparity with respect to breast cancer when you're talking about socioeconomics, race, education levels, and so on?
Yeah, that's an issue we're really trying to tackle right now on a national basis and also here locally, because particularly women of color, African American women, Latino women tend to be diagnosed later, tend to be diagnosed at an earlier age, and also tend to be diagnosed with more aggressive cancers. So there are a lot of different interventions that we're really trying to understand how they might play into getting those women into better treatment faster, and also to make sure that treatments are available for them if they have those aggressive forms.
You know, that statistic I said at the beginning about the second highest incidence of breast cancer in Massachusetts in the country, I just find that
It's shocking, right?
very shocking. You know.
Yeah.
But you say it's incidence, but it's not mortality rate?
Right. So because we do have very good health care in Massachusetts, we do have a relatively low mortality rate. The incidence rate, you know, people are always trying to say, well, do you know what causes it? And gosh, we wish we did, but we really don't. It's not a disease that's affected by anything. You know, your biggest risk factors are being a woman and being older.
Mm-hmm. And talk a little bit more about the special reception you've got coming up later this week at the Algonquin Club of Boston.
We love being at the Algonquin Club. It's such an elegant location, and Alexis of Watertown helps us put on a really nice cocktail party for the Pink Tie Guys and their guests to celebrate their achievement and learn a little bit more about what we're up to.
And you talk about I guess the role that men play. Talk a little bit more about that. About I guess what you're trying to the message you're trying to get out about the role men can play in the fight against breast cancer.
Right. I mean, we often refer to the men in the family as the co-survivor. You know, it's a process that affects the whole family. When someone is undergoing cancer treatment, it's not something that is just happening to them. And this is a way for men to feel like they can actually do something, take an action that's going to help either their own families or families who will have someone diagnosed in the future.
Okay, Lori Van Dam. Well, thanks for coming in, and good luck raising that $108,000. And congratulations on rounding up all those Pink Tie Guys.
Excellent. Thank you so much.
Okay, thanks, Lori. Well, that's it for this edition of Urban Update. I'm Byron Barnett. For all of us here at Urban Update, have a great Sunday, everyone. We'll see you next week.